Welcome to our presentation on a community-based task shifting program in 25 remote Indigenous communities in Nunavut. This is a new article, 2025, and it looks at a local application of task shifting to improve healthcare in this remote area. So we know task shifting redistributes healthcare tasks to less specialized workers. It's known to improve efficiency and accessibility in under-resourced regions. For Nunavut, it has 25 fly-in communities with limited healthcare access. And so this program is about a community-based diagnostic X-ray training program that's aiming to fill this healthcare gap. So the definition of task shifting, as we've learned, is the transfer of tasks from highly trained professionals to those with fewer qualifications. The benefits are enhanced service availability, it reduces the burden on specialized professionals, it addresses human resource shortages in healthcare, and it's supported by WHO as a viable healthcare model. So the health challenges in Nunavut. There are remote and isolated communities north of the 60th parallel with limited healthcare facilities and staff. There is a high evacuation rates for basic diagnostics and a lack of radiology services and trained technicians. The task shifting model in Nunavut is to train community members as basic radiological technicians. The training was provided at local health centers to allow x-rays to be taken locally and transmitted digitally for diagnosis, and this reduces patient travel and improves timely diagnosis. The program implementation had three parts. First, a feasibility study was completed to assess the community needs and engage stakeholders and government bodies. A training model was developed. The training took place over 12 to 18 months, divided into three phases. It was a blended learning approach with in-person and online training, with practical assessments and competency-based training. And then the collaboration part was key, partnerships between government, NGOs, and healthcare professionals. The training outcomes and impact. 68 students were trained since 2018. There was increased retention of trained staff within communities. It strengthened the local healthcare workforce. The image quality was improved and assessed by radiologists, and it reduced patient referrals to urban centers. The PACS system was used, which stands for Picture, Archiving, and Communication System. And this allows for digital transmission of X-ray images to urban radiologists. It reduces the delays in diagnostic and treatment and ensures quality control through remote expert assessment. The key findings and benefits were that it strengthened healthcare workforce in remote regions. It improved access to timely and quality healthcare. It's a sustainable and cost-effective approach. It empowered community through local training, and it reduced healthcare disparities for Indigenous populations. Along with an approach like this are always challenges that you need to be mindful of and to consider. There were some resistance from traditional healthcare providers. There is a need for continued government and regulatory support to ensure sustainability and long-term funding. And there's always a need to address evolving healthcare needs and technology as technology changes. However, the overall conclusion and future directions was that task shifting has significantly improved healthcare access in Nunavut. Community-based training can be a model for other remote areas. There is a need for continued investment in training and support, and there is the potential of expansion of the program to other diagnostic services. Thanks for listening.